This is Mahsa from Art of Injection Academy. In this video, I want to talk about the difference between vascular occlusion and arterial occlusion. In aesthetic injectables, vascular occlusion is an umbrella term. But clinically, it's important to understand that there are different mechanisms and each one behaves slightly differently in presentation and urgency. The first and most classic type is arterial occlusion, which happens when filler is injected directly into an artery or compresses it enough to block the blood flow. This is the most time-sensitive form because it stops oxygenated blood from reaching the tissue. Patients typically present with immediate or rapidly developing severe pain, blanching, coolness, and livido or mottled pattern as ischemia progresses. If not treated quickly, it can lead to tissue necrosis, or in certain high-risk areas like the glabella or nose, even ocular complications. A second type is venous outflow obstruction, which is less dramatic initially, but is still important. In this case, arterial inflow is still occurring, but venous drainage is impaired, often due to compression from the filler, swelling, or high volume placement. Clinically, this appears as dusty bluish-purple discoloration, edema, and congested heavy appearance of the tissue rather than frank blanching. It can still progress if it's not addressed, but it is generally less acute than arterial compression. In short, all arterial occlusions are vascular occlusions, but not all vascular occlusions are arterial. And that distinction is what guides urgency and management.